Did you have any dental work done prior to this back pain? And she said, well, come to think of it, I did. I had an infected tooth. I had a root canal done. The root canal failed. I had another redo of the root canal. It also failed. I had the root canal tooth pulled, and I had a graft put in there, and I had an implant put in there. So I said, let's do an experiment in the office. I can inject a local anesthetic on that tooth. If your back pain is related to that tooth, and I block the nerve coming from that tooth, it may make your back pain feel better. And that may be the reason for your pain, because after 2 failed surgeries, another one, the chances of it working aren't very good. So she said, I'm in. So I took some local anesthetic and I injected her tooth, and I waited about 15 minutes. And when I came back into the room, she was standing up going like this. I said, how does it feel? She says, it feels 90% gone. I said, then probably this is linked to that tooth. I just want to make sure. You come back in 3 days, we're going to do this again. I want to make sure that just isn't as a relief reaction, sort of a mental, that this is all psychosomatic and it's gone. We did it again, and she said, it's gone. I'm going back to the oral surgeon, and I'm going to have him take the darn implant out. Within a couple of weeks, her back pain, except for what was leftover surgical trauma, was gone.